This presentation is on CSSD records and registers. The CSSD plays a critical role in ensuring that the surgical instruments and other items are sterilized and delivered in a quality assured level. There should be an evidence-based record keeping system to ensure sterility of medical instruments, audit purpose, legal issues, in case of an incident to trace out the incrimination items. CSSD registers need to be neatly labeled for easy access. The sterilization quality record are retained for the period of 3 years. Recall register, incident register, surgical site infection registers are kept permanently. All outdated records list has to be signed by the CSSD in charge and then discarded. The documentation identification slip as shown in the picture indicates the name of the register, register number, location, document period, retention period and the person responsible for it. This slide shows the list of the documents. All these documents are to be kept in the CSSD department and CSSD staff are responsible for it. Let us take a look into each of the documents. First, the steam sterilization material received and issued log register. This register's purpose is to avoid any missing in the received and issued items. It contains the log for the number of received and issued items and the signature. The entry is done whenever receiving and issuing the items. The CSSD sister is responsible for this register. It is kept in the sterile storage room while issuing the items and in the CSSD clean room while receiving unsterile items. This picture shows the entry of sterilization process, material received and issued logbook. Next, steam sterilization log. This register's purpose is to track the details of the sterilization cycle. It contains class 1 indicator tape which shows the sterilizer ID, cycle number, details of items and the operator, the sterilization parameters of the temperature, pressure and sterile time. The entry is done while operating each cycle. It is kept in the autoclave room and in between sterilization room. This picture shows the entry of steam sterilization log. Next, steam sterilization chemical indicator file. This register is to document the evidence of class 5 indicator results. It contains date, cycle time, autoclave ID, operating person, Sterigod strip. The entry is made for every cycle and documented. It is kept in the steam sterilization room and in between the sterilization room. This picture shows the entry of the steam sterilization chemical indicator file. Next, the steam sterilization processing print file. This register's purpose is to verify sterilization parameters and evidence for physical validation of sterilization process. It contains machine printout, class 1 indicator tape. The entry is made for each cycle. It is kept in the steam sterilization room. This picture shows the entry of steam sterilization processing print file. Next is the Bovidic test results record. This register's purpose is to maintain evidence for class 2 chemical indicator test and the results for vacuum removal. It contains Bovidic card, sterilizer ID, operator and the person who is verified. The entry is made weekly once. This picture shows the Bovidic test results record. Next is the ETO material received and issued log. This register's purpose is to avoid any missing in the received and issued items for ETO. It contains the log for the number of received and issued items and the signature of received and issued sister. The entry is made whenever receiving and issuing the items and the CSSD sister is in charge for maintaining it. It is kept in the steam sterile storage room while issuing the ETO register record and while receiving unsterile items it is kept in the CSSD clean room. This picture shows the entry of ETO material received and issued log. Next is the ETO sterilization monitoring record. The purpose of this register is to maintain a sterilization log for verification. It contains machine printout, class 1 and 4 indicator tape, exposure time, aeration time and the temperature. The entry is made for every cycle. It is kept in the ETO sterilizer room. This picture shows the entry of ETO sterilization monitoring record. ETO pack entry checking record. The purpose of this record is to cross-check ETO sterilized pack. It contains date, operating theatre name, any expired, very near to expiry and damaged pack kept inside the operating room. The entry is made every Saturday in all the operating room. This picture shows the ETO pack checking record. Next is the biological indicated test results for both ETO and steam sterilization. The purpose of this record is to maintain evidence for validation of sterilization process by the biological indicated test results. It contains the report from the microbiology department. It is done once in a week, and the register is placed in the CSSD room, and CSSD sister is responsible for maintaining it. This picture shows the biological indicated test results of both the ETO and the steam sterilization. Sterilization incident register. The purpose of this register is to document the incident happened, and by analyzing the incident can take necessary preventive measures to avoid any reoccurrence. It contains the nature of incident, corrective and preventive actions, signature of responsible person, CSSD senior and the in charge person. The entry is made whenever the incident happens, and the CSSD senior and in charge person is responsible for maintaining the register. This picture shows an entry made in the sterilization incident register. Sterilization recall register. The purpose is to document sterilization recall to ensure the suspected items are not used for patients. It contains reason for recall, notification, items recalled, re-sterilization, corrective and preventive action. The entry takes place whenever recall happens, and the CSSD senior and CSSD in charge person is responsible to maintain the register. An example of such entry is shown here. Consumables culture result register. The purpose is to ensure the consumables like saline solution, glutazole, etc. are cultured and pH tested before issuing to the operation theatre for use. It contains consumables culture report from the microbiology laboratory. The entry is made whenever receiving a new batch from the supplier. One random pack will be sent for the microbiology lab for the culture result to be recorded. This picture shows the consumables culture result register, RO and raw water culture result register. The purpose is to ensure the raw and RO water culture, pH and chemical analysis results are within the normal range. It contains RO and raw water culture and pH result. The entry is made every 15 days. This picture shows the RO and raw water culture result register. RO water chemical analysis results register. The purpose is to ensure the RO water chemical analysis result is within the normal range. It contains RO water chemical results entered in. The entry is done every month. The picture shows the RO water chemical analysis register. Next is the RO raw water tank cleaning register. The purpose is to ensure the RO and raw water tank is cleaned as per the schedule. It contains date of cleaning, cleaned by person's signature, verified by the CSSD staff. The entry is made whenever raw water tank cleaning and RO water tank cleaning is done. The protocol is to do raw water tank cleaning once in 2 months and RO water tank cleaning once in a month. The staff responsible for this is the RO plant operator, housekeeping senior staff and the CSSD senior sister. This is an example of the entry shown in the RO and raw water tank cleaning register. Next is the OT fumigation register. The purpose is to ensure all areas of the operating theatre were adequately fumigated. It contains date, place, exposure time, fumigated by the person's signature. The entry is done whenever fumigation takes place. Fogging is done on Wednesday and Saturday. Other days, exposure with formalin soaked cotton pad is done. The responsible person is the CSSD senior staff and the register is kept in the CSSD department. This picture shows the OT fumigation record. Next is the microbiology surveillance result of OT. The purpose of the register is to maintain evidence and to ensure that the microbiological load of operating theatre environment is maintained as per the specified acceptance criteria. It contains culture results from the microbiology laboratory. The entry is done monthly once and whenever required. This slide shows the microbiological surveillance result of the operating theatre. Quality indicator record. The purpose of this record is to assess the performance of CSSD activities. It contains quality indicator criteria, pass, fail status, quality indicator score, signature of CSSD in charge. The documentation is done every day and calculate score at the end of the month. This picture shows the quality indicator record. Next is the surgical site infection rate register. The purpose is to evaluate the SSI. It contains total number of surgeries, number of infected cases and the percentage of SSI. The entry is made at the end of the month. This is an example of such entry made. Laundry log. This purpose is to make sure the used linens were washed to prevent any missing of linen from the laundry. It contains date given, received, checked by and number of linens that were given. The entry is done whenever giving and receiving linen from the laundry. This picture shows the laundry log. Next is the soiled linen washing record. The purpose of this register is to ensure the soiled linen washed as per specified procedure. It contains the date, number of soiled linen, source, washed by and checked by person signature. The entry is done daily or whenever washing of the linen, soiled linen happens. CSSD is in charge and the record is placed in the OT laundry. This picture shows the soiled linen washing record. Next is the list of equipments. The purpose is to document the available equipments in the CSSD department. It contains name of the equipment, equipment ID, location, installation date and service engineer contact details. The picture shows the list of equipments. Next is the equipment maintenance schedule. This register is a yearly planner for equipment maintenance to prevent any missing of maintenance as per the schedule. It contains the name of the equipment, scheduled month for maintenance and calibration and status of scheduled plan. Prepare the schedule at the beginning of the year. Check every month for any planned schedule needed to be finished. This slide shows equipment maintenance schedule as an example. Next is the equipment calibration results report. The purpose is to maintain evidence for calibration. It contains calibration result issued by the calibration service agency. This picture shows equipment calibration result given by the company. The equipment preventive maintenance report. The purpose of this report is to ensure preventive maintenance services done properly. A proper PM service will reduce the equipment breakdown. One should be aware of the replaced parts and the equipment condition. The register contains the PM service report and it is the CSSD senior staff's responsibility to maintain a proper preventive maintenance report. An example of the PM report is shown in this slide. Similar maintenance by the CSSD department is also shown in this slide. Next is the equipment downtime register. The purpose of this is to document equipment breakdown and alternate arrangements that have been made. It contains the name of the equipment, nature of breakdown, duration of downtime, alternate arrangement, corrective and preventive actions that were taken. The entry is done when facing equipment breakdown. The entry to be made is shown in this picture. Coming on to the training records, first is the employee training record. The purpose is to plan and cover all areas for employee training within the training period. This is to ensure that the staff were trained in all relevant fields. It contains name of the employee, date of joining, designation, training area, period and training given by the person. The entry has to be done whenever a new employee is joining into the CSSD department. An example of such entry is shown in this picture. Next is the employee training evaluation form. The purpose is to ensure that the employee is adequately trained. It contains name of employee, training area and the evaluation report. The entry is made while completing each training topic. An example of the training evaluation form is given in this picture. Next is the employee training needs identification form. The purpose is to make training plan for retraining. It is done after employee training evaluation and whenever it is necessary. An example of such employee training needs identification form is given in this picture. Next is the indent record. The purpose is to document materials intended for the hospital stores. It contains data, item, name, quantity required and approved by person signature. It is done whenever indenting from the stores. An example of such indent record is shown in this picture. The linen stock register. The purpose of this register is to make sure the required new linens are maintained in the stock and can easily know when the stock reaching its reorder level. It contains name of the linen item, reorder level and available stock. It is done while issuing for use, receiving new and check reorder level every month. An example of the linen stock register is shown in this picture. Biomedical waste clearance register. The purpose of this register is to ensure the biomedical waste are cleared from the operating room at regular interval and at the end of the operating theatre's work. It contains the area, biomedical waste category, cleared by and checked by person's signature. It is done during OT hours at regular intervals and at the end of the day. An example of the entry sheet is given for our reference. The biomedical waste weighing record. This purpose is to calculate the weight of the biomedical waste that is sent to external agency for the biomedical waste treatment. We can plan to reduce or to avoid increasing biomedical waste weight. It contains the biomedical weight category wise and the date in which the biomedical waste was recorded. This has to be entered every day. An example of such entry is shown in this slide. Next is the OT cleaning register. The purpose is to make sure the operating room was mopped and the biological waste was cleared in the appropriate intervals during the surgery. It consists of the name of the operating theatre, cleaning status, cleaned by and verified by the CSSD staff. The entry is done during the surgery and every hourly basis. The register is kept inside the OT and in between sterilization room. Example of the OT sterilization register is shown in this picture. Next is the temperature and humidity record. The purpose is to make sure the operating room temperature and the moisture are maintained and recorded well. It contains the operating room temperature, moisture and checked by person's signature. It is done every day, preferably early in the mornings. This picture shows the entry of the temperature and humidity record. Next is the OT work completion checklist. It consists of checklists for daily work completion. It shows the list of routine activities that has to be checked before leaving the operating theatre. It is done daily at early morning, during the surgery, at the end of the day. CSSD staff are in charge for maintaining a proper filling of the OT work completion checklist. This slide shows the checklist in detail. Next is the CSSD calendar. It is a daily activity planner. It shows routine activity that needs to be completed before closing the OT. It has to be checked daily and the CSSD sister is in charge for creating and maintaining the CSSD calendar. This slide shows a month's CSSD activity planner. Last is the OT sterilization register. It is maintained in each operating room. Steam sterilization and ETO pack class 1 indicator labels are pasted in the register. Instruments, linen and dressing bin labels and Sterigarch class 5 indicators are pasted for reference. Batch number of consumables such as Orocaine, Orodone, RL, BSS, Oroblue, Visco, Moxie, etc. are noted. Operating room temperature and humidity has to be noted. The CSSD sister will check and sign all the operating room sterilization register. The surgeon will check and sign it before starting the surgical hand scrubbing. This picture shows the OT sterilization register. All these entries are very important and done every day before the start of the OT. It is mandatory to perform meticulous entry of all these registers to ensure a quality assured care for all our patients in the operating room. Thank you.